Hello everyone, I am Dr. Sanket Gupta. I am a practicing homeopathic consultant at AKG's OVM's medical centers, and we have our clinics at Moti Bagh and Pitampura. And today I would like to talk about a disease called hypothyroidism. Again, a very common disease, a very common endocrine disorder, one of the most common endocrine disorders. And as the name suggests, hypo means less. So what happens is the thyroid gland secretes thyroid hormones in a very less quantity. So the thyroid hormones T3 and T4 are released very less, and there are only two major reasons. The first major reason being thyroid gland not functioning properly, which happens usually when there is lack of iodine or deficiency of iodine. As you must have seen, a lot of people develop goiter or huge growth around their necks. That is goitrous, and that is due to deficiency of iodine. The second cause being the pituitary gland, which releases less of thyroid stimulating hormone, which in turn actually activates and stimulates the thyroid gland to release the thyroid hormones. So these are the two major causes, and clinically what we find in the investigatory findings of the thyroid profile, we find thyroid stimulating hormone is usually high in people with hypothyroidism, and the T3 and T4 levels are generally low. Another major reason could be an autoimmune thyroiditis, and this autoimmune thyroiditis means when the cells of your own body are working against your own body cells, are working against your own receptor or own glands, and preventing it from stimulating the thyroid hormones normally. In this case, we need to get anti-TPO and thyroid binding antibody globulins to test it. Homeopathy fortunately has a very good result and very good effective treatment in both the cases, be it autoimmune disorder or be it the classical hypothyroidism, which we see in generally most of the cases. Symptomatically, patients start the disease dose sets in quite early, but the symptoms start manifesting very late in the life, and symptoms like weight gain, symptoms like dry skin, fatigue, weakness, breathlessness even at times, slow pulse rate, falling of hair, irregular periods, constipation, depression, they're all guiding you towards hypothyroidism. So one thing is, if there is an iodine deficiency, it can always be supplemented by taking iodized salts, which we see these days, and that prevents the formation of goiter. The second thing being a secondary hypothyroidism, where it is generally due to the lack of thyroid hormones due to the inefficiency of the thyroid gland. The role of homeopathy is very important. What homeopathy does is it tries to only stimulate the thyroid gland to release the thyroid hormones properly, tries to maintain that homeostasis, tries to maintain that balance. It is not that we are giving something from outside which will release the chemical and work on its own, and the thyroid gland would be sitting pretty on its side. No, what we do with homeopathy, what homeopathic medicines do, they stimulate the thyroid gland to function on its own, to fight on its own, and this is how thyroid is completely, all thyroid disorders are completely curable with homeopathy. There is no need to be on lifelong medication for hypothyroidism or even hyperthyroidism per se. Even at times when people are given anti-thyroid drugs for hyperthyroidism, they get converted into hypothyroidism due to the medication, over medication. So there are a lot of factors which we tend to see over our clinics. All of them are taken into account, and accordingly treatment is given. But definitely homeopathy has a huge role to play in public health when it comes to hypothyroidism, and is a beautiful treatment of medicine without any side effects, and absolutely curable for thyroid disorders. For any queries related to hypothyroidism or any other disorder, you can consult me here on Lybrate or consult me at my clinics. Thank you.